So this is going to be a quick review for the retropharyngeal area. We will start with our layers. So what are all the fascia layers if we go from more superficial or the front of the body? So let's say from the neck, and we're going inside to the spinal cord. So we will do the layers 1, 2, 3, 4. So the first one we have is the investing cervical fascia. Then we should have our pretracheal fascia, which is in front of the trachea and not behind the trachea is esophagus, and behind the esophagus we have the buccopharyngeal fascia. After the buccopharyngeal fascia we have alar fascia, and then after alar fascia we have the prevertebral fascia. But the interesting thing here is that between buccopharyngeal and alar fascia we have something called the I'll start with, we have danger 3, which is retropharyngeal space. So the retropharyngeal space, or danger space number 3, is between buccopharyngeal fascia and alar fascia because they're both connected at about level, or they close off at about level C7. So imagine they both fascia go to C7 and they sandwich in. That space is called retropharyngeal space. Whereas alar fascia and prevertebral fascia are open and they form danger space number 4, which is continuous because it's open all the way to the mediastinum and can give us some heart infections or heart problems. Another cool thing is that we also have something called the lateropharyngeal space, which is directly linked with the retropharyngeal space. And lateropharyngeal space is important in dentistry because any infection you have between the medial pterygoid and the masseteric, or it's a masseter. If you have anything in between the masseter and the medial pterygoid muscle, that can basically leak. So let's say we have a molar infection, third molar infection, that will leak into that lateral pharyngeal space, which will go into the retropharyngeal space, which will break the alar fascia and continue and go to the heart and causes heart problem. So this could be a cause of why periodontal problems can lead to some type of heart issues, as well heart attacks. Here we can see the layers once again. If we go from the beginning, we should have our way up outside is going to be the investing cervical fascia, number 1 here. Then we have the pretracheal fascia out front. We should have a buccopharyngeal fascia back here in green. You can see there. After buccopharyngeal fascia, in purple, we have the alar fascia, and between the buccopharyngeal and alar fascia, we have the retropharyngeal space, number 3, which is continuous with the lateral pharyngeal space. And these are both closed off, the buccopharyngeal and alar fascia, whereas alar fascia and prevertebral are not closed off, and that makes you the danger space number 4. If we look from the top here, once again we should have our investing cervical fascia here. We should have the pretracheal fascia in front of the trachea. We have a buccopharyngeal fascia here in black. We have in purple, we have the alar fascia, and in blue, we have the prevertebral fascia. And these formed danger space 4, and in front of alar was danger space 3, linked to the lateral pharyngeal space. If we keep going here, we will just start with our muscles in that retropharyngeal area. So here we can see we have 2 types of labels going on. So first, we can see on the left side is all the muscles, and then what this image shows is that if we cut the muscles in half at the pharyngeal raphe, then we see the back, the mucosa, or the oropharynx up here, the nasopharynx, and the laryngopharynx, and the esophagus down here. So that's what you're seeing with the arteries and nerves as well. So if we look at the left side, we have three muscles, three constrictor muscles: superior constrictor, middle constrictor, and inferior constrictor. Superior constrictor originates in the pterygomandibular raphe, and will join the pharyngeal tubercle up top here. Second, middle constrictor originates in the hyoid bone and will join the middle pharyngeal raphe. Third, middle inferior pharyngeal constrictor will originate in the cricoid or the thyroid cartilage and will also insert into the pharyngeal raphe in the middle midline. So here you see that another muscle that's very important is stylopharyngeus. Stylopharyngeus is innervated by glossopharyngeal nerve. That is the only muscle that's innervated by number 9. Everything else is innervated by vagus, number 10. C and 10. And we know that stylopharyngeus, as you can see here, is always in between superior constrictor and middle constrictor, along with its nerve, the glossopharyngeal nerve, as you can see on this side. Other longitudinal muscles we have besides stylopharyngeus is salpingopharyngeus. So stylopharyngeus is one. We have salpingopharyngeus and pallidopharyngeus. These two, like we said, is innervated by vagus, whereas this one is the only innervated by glossopharyngeal. We also have, basically here you can see in white, that is our pterygomandibular raphe. That is where is the origin of the superior constrictor should be. So it should origin here, and then is going to insert into the pharyngeal tubercle. 9 glossopharyngeal that provides innervation to stylopharyngeus. Mostly you find it in between the superior and middle constrictor, whereas vagus is the arrow, basically, the arrowhead, and will give innervation to most of the muscles. If we talk about the arrow real quick, we have the arrow. This is a lateral side. This is a medial side. The arrow is the vagus nerve. It will give laterally, it will give hypoglossal nerve. And then medially, it will give the branch from vagus, which is superior laryngeal nerve. That becomes into the internal and external. And external we know is efferent to the cricothyroid. Internal pierces the thyroid membrane for afferent innervation. So just know the arrow, vagus, hypoglossal, superior laryngeal is medial. So now going to the glossopharyngeal, number 9, provides most of the afferent as well as the stylopharyngeus. So we have pharyngeal branches right here, number 1. They provide afferent to the mucosa. We have an efferent to the stylopharyngeus muscle, the only muscle, and then some external, such as tympanic, carotid, and tonsillar branches. In vagus, we know we'll have most of the or all of the constrictors and the longitudinal muscle except stylopharyngeus. So here it provides all the pharyngeal muscles except stylopharyngeus and tensor veli palatini. Then we have the superior laryngeal, which will innervate into internal and external. And then we have the recurrent, which we will find in between the trachea and esophagus, giving us some type of efferent. And then some branches that go to the carotid, body, the cardiac branches, thoracic, and abdomen. So here, once again, we can see the superior constrictor, middle constrictor that origin from the hyoid bone, and inferior constrictor. In between those, we find the stylopharyngeus artery along with the nerve. On this side, you can see glossopharyngeal nerve and stylopharyngeus. They're both together. They should be in between our superior constrictor and the middle constrictor. Then we have vagus, which is the arrow. Vagus will run up and will give you the branches that we just talked about. You also have salpingopharyngeus muscle, pallidopharyngeus muscle, and all the constrictor muscles that are innervated by number 10, vagus.